Hello, everyone, and welcome to another episode of Detox Digest with Dr. Morse's Healing Herbs.
Yes, hello everyone. And whether you're a seasoned detox enthusiast just starting your wellness journey or anywhere in between, Detox Digest is your go to resource for gathering that knowledge and the tools to support your body's natural cleansing and healing processes using diet, herbs, and Dr. Morse's formulas. I'm Jenn Billingham.
And I'm Colleen Bingham. If you're new here, Jen and I have been covering all the body systems. We're pretty much at the end here. We've been doing this since February of this year. We started with the urinary system and the lymphatic system. Then we headed into digestion, endocrine, nervous system, goes on and on. So be sure to check out all those archived recordings on our YouTube channel, or they're also embedded into all of our associated blogs on our website at drmorses.com. Go to the Learn tab. And today we are continuing our discussion on whole body detox with a deep dive into the musculoskeletal system.
Yes, indeed. I'm going to look forward to this one. So grab your favorite herbal tea or fruit snack, I guess, and let's begin. So just stick with us. Stay tuned for these valuable insights into the musculoskeletal system and how best to support this system, your body, really, for vibrant well-being.
Absolutely. Hi, Jen. How you doing?
I'm pretty good. Can't get my left eye to stop watering, and hopefully no one will hear my stomach growling over the microphone. Should have had a little bit more, but yeah,
More fruit
I'm
snacks
good.
to
How
snack
about
on.
you?
Yeah. Yeah, I feel that. Yeah, I'm loving it. I'm glad we're here. It's the
Yes,
end of, it's
absolutely.
almost Halloween. It's the end of the month.
Tomorrow, yeah.
Yeah, so thanks all for joining us. And so here we are. Thank you, Dr. Morse, for bringing us all together. Dr. Morse's life work is to unlock the body's natural ability to heal by supporting its regenerative detoxification process. Thank you, Dr. Robert Morse, for
Yes.
making this possible. So it's somewhat interactive. We do have a Q&A feature. Whether you have joined us on YouTube or you are on the Goto platform, there is a way for you to submit your questions, and we will do our best. We have an amazing support staff here. Stephanie and Kim are both here to answer your questions. But if your question goes unanswered, you can always email us at info@dmhhc.com, and we will get back to you with all of your answers.
Yes.
And of course, stick around till the end of our presentation, where we will be giving you a really great discount on every single product and formula that we talk about today. So it's really something you don't want to miss. And if you've joined us on YouTube and you're just kind of scrolling through and found us, you actually do need to use the link that that Gavin is going to be dropping into the chat feature over there, and that link will take you to our webinar page, and there's a little registration window in there. Well, you're going to put your email address in there, and that will allow us to email you a follow-up email after we're done today, and that will include the code, the discount code, as well as a link to the recording. So again, if you are visiting us on YouTube and you have yet to register for this webinar, please go to our site, find that window, or follow the link that Gavin gives you in the chat, and head over to the site to sign up for a follow-up email. Great. Okay, now on to the good stuff.
Yep. So this is what we're going to be talking about today, the agenda. And as you know, sometimes Colleen and I can run a little over. We're going to try not to and save
Do
room
our
for that
best.
good stuff at the end. So we'll have that musculoskeletal system A and P, and then we're going to get into those herbal protocols and the herb walk for bone and joint health and muscle health, and then some. Got to save some time for those additional therapeutics because we do really think you'll find a lot of benefit from those. So
They're fun.
yeah, let's jump into this A and P.
Great. Okay. Well, let's start with the theme of what we're all
Yes.
doing here today. It's not always A and P. It's not at all heady stuff, right? We want to just really drop into what's going on right now. It is fall. We are a month into fall, the fall equinox, which means that our days are getting shorter, our nights are getting colder, and this season is all about preparedness, right? Winter is coming. It's inevitable. And I know a lot of you joining us probably live in warmer climates, a lot of Floridians. Shout out. So, according to Jen, all you're really getting is a little wind.
Yeah, yeah.
But for any of you that is coming from a more temperate region where it is definitely showing signs of winter, this is that season that reminds you that, okay, winter is coming. Winter is a time of introspection. We'll be spending more time indoors, more time with family, less productive because of holiday events and things like that. So how can we really, in this moment in the fall, take the time to prepare our bodies, prepare our minds, and prepare our living spaces for all that time that we're going to be spending indoors and inside our own consciousness. So these kind of interim seasons, fall and spring, the equinoxes, those are those preparedness seasons. Those are those opportunities before the extreme heat of summer and the extreme expansiveness of summer, or before the cold of winter and the introspection of winter. These in between seasons are our prep seasons. And so Jenn's going to talk a little bit more about what that looks like from a detox perspective.
Yes. And like you're saying, it's preparedness. And when I was thinking about that, just with the seasonal detox, because it is really fun and helpful to think of cleansing, on the seasonal, from the seasonal
Mhm.
point of view. So you could think of this time of year when it comes to detoxification as a gentle and nurturing period for detoxification. We're approaching winter. And, some people want that last push before winter comes to where, like Colleen was saying, you want, it's that introspective. You want to, maybe pull back, just prepare, let your body take a break. And the other inevitable question that comes up this time of year is how do I eat? Especially with detoxification, you can take herbs all the time, but look at the different foods available to you in your region, this time of year. There is that shift that takes place naturally in all of these different regions. And the food available to you is very, very different. Even here in Florida, but yeah, we're a subtropical climate, but it doesn't mean the fruits are always fresh and, perfectly ripe when you get them. So it's
Mhm.
it's very natural for you to prepare to nourish your body for the environmental changes to come, for these changes in seasons, and just adhere to like that seasonal rule you've heard Dr. Morse talk about. Try to get stuff what's in season, try to get what's local and regionally available to you. And, this is a good time to really slow down. Think about how far you've come. Again, winter, we might do this a little bit more. Just evaluate your progress, set some intentions, give it that last push if you need, and just really try to adapt. Think about, like Dr. Colleen was saying, the sun, everything's changing, the days are getting shorter. Really look at your stress levels, your circadian rhythms. Really get
Mhm.
in tune with your body, get in touch, spend some time gearing up to reflect. That way when spring comes around, things can start gearing up again. So
Mhm.
yeah, really integrate some intention into your detox at this point and think ahead, prepare.
I love that
I think that's the
intention.
key word.
Yeah,
Yep.
setting intentions is beautiful. It's a
Yep.
great way to think of it. Yeah, so we're going to dive into some detox protocols today, as well as talk about musculoskeletal support. So, right now, let's talk about the anatomy and physiology of the system, get this heady stuff out of the way, and
Hmm.
then we'll jump into some protocols. So, here we have the musculoskeletal system, which is comprised of obviously the muscles and the skeletal system. And so, just real quick, any movement that you make right now is all thanks to your musculoskeletal system and a little help from your brain, obviously. So we'll talk the so be sure to stretch throughout this webinar. It's very important. It's actually a requirement that you get up and stretch and move your body, even if Jenn and I are stuck to our chairs and
Yep.
our microphones. But the muscular system. So this is all the muscles throughout your body. There's three different categories or types of muscle within the body. There's the cardiac muscle of the heart. There's your skeletal muscle, which connects with tendons to the bone. And then there is your smooth muscle. And so as you can see on this slide, involuntary, do you remember these words from our nervous system webinar? If not, be sure to go back and watch the archived recording. But we have our nervous system, which is involved in all of the muscle movement in our body. We have a thought and we want to reach for something. That's a voluntary movement. So that's all skeletal muscles. All of our skeletal muscles are governed by the somatic nervous system, our voluntary, we choose to move, we choose to take the step forward. Whereas our heart and all of our smooth muscles are involuntary. They are governed by the autonomic nervous system. So automatic. It's just happening on its own. We don't have to think about it. Pretty amazing, right? So there is that brain, nervous system, and muscular connection, which we'll talk about more in a moment. And there is just really important to point out here the main category of muscles we're going to be talking about today are those smooth muscles, because those smooth muscles are the hollow, that's all the muscles that comprise your hollow visceral organs. Your smooth muscles are in the uterus, they're in the GI tract, the small intestine, and the lungs. So we're going to be talking a lot about antispasmodic herbs And all those herbs are specifically supportive to relaxing smooth muscle. So now uterus, GI tract, lungs, now you're starting to connect. Okay, that's why that's happening there. Okay, more on that later. And so just again, together these muscle types, they all integrate into one system that enables movement, also contributes to circulation, digestion, breathing, and overall health and detoxification. More on that in a moment.
Yes. Yep. All right. So the skeletal system, pretty much everyone knows about this. And goodness, 206 bones. This is the framework to support your body. And they're divided into two main groups. And you can see it here on the screen, the axial skeleton and the appendicular skeleton. And bones contain active connective tissue. It's very active and alive. We're going to talk about that a little bit more in a moment. They're regenerating every 7 to 10 years. So take a look at the diagram on the screen. You have the axial skeleton that includes the skull, the vertebral column, the rib cage. It does protect vital organs. You think about the rib cage protects those lungs and the heart. Also, your skull protects your brain, and it also serves as the main axis for supporting the body's weight. And also, so posture is important, people. And the appendicular skeleton consists of your limbs, like the shoulder girdle, the pelvic girdle, and also is responsible for facilitating the movement and the interaction with your environment. And you can go ahead and get a coloring book, memorize all these 206 bones. I don't recommend memorizing all the muscles unless you're doing that for a career, but the skeletal system's kind of fun. That was totally overwhelming. But so in addition to providing that structural support, they do play crucial roles. I can't talk today. This is a lack of food, probably. So it does protect your organs. It produces blood cells in the bone marrow. We're going to talk about that. Stores essential minerals like calcium and phosphorus. We're also going to talk about its role in detoxification when we're talking about metals and chemicals and stuff. And it's just, you need your skeletal system to maintain the body's overall strength and mobility and that mineral balance too.
Yep, absolutely. Nice. And we really don't want to dive too deep. As Jenn said, there's just so much to memorize. We're not really here to memorize a bunch of names of bones and joints. So we're going to just kind of dive into the, I don't know it.
No.
I love that. So we are really going to put it all together to that detox perspective, which is what we love to do here. So this kind of goes into the physiology of the muscles and the bones. And what's really important to note here is that accumulation of toxins, right? So in the muscles and in the tissues of the bones and the muscles, when there's poor circulation, dehydration, and overwhelmed detox, or an overwhelming amount of toxins in the system, those detox pathways are overwhelmed, and those toxins tend to settle in the muscles, causing stiffness, soreness, and acidosis. Which you all, so this is kind of the end point, right? So we start to feel it in our bones as we have this saying that we say all the time, I feel it in my bones. That's kind of the end point of how living a toxic lifestyle or having something in your environment that might be affecting you, how that is all kind of building up in the system. And this is that final kind of cry for help. So we're going to see how we can really open up and remove that buildup of toxicity in the muscles to help reduce that discomfort.
Yes. And as Colleen was saying earlier, the nervous system and the musculoskeletal system are, they're intimately connected to control that movement, maintain your posture, speaking of that, and ensure balance, and it also, transmits signals of pain too. So through the brain and the spinal cord, the nervous system sends signals to the muscles to contract or relax. It enables movement. The muscles, tendons, and joints, they have specialized sensory receptors that send feedback to the brain about your position, your tension, and your movement. And this is a sense known as proprioception, and it allows the brain to coordinate movements accurately, adjust your posture, prevent that injury by modulating, your muscular activity, and reflexes. I know you all know about reflexes. How many, either you went to a physician or you've tested it out yourself, kind of bopped your knee to see what your knee-jerk reflection is. And these are reflex arcs. They're direct pathways in which, that sensory input from muscles and joints triggers that motor response from the spinal cord. And it doesn't need to process through the brain. That's why it's just that nickname, that knee-jerk reaction. It protects the body. It does help maintain balance. You have to respond quickly to sudden changes. And so Yeah, that I think that pretty much covers everything. I don't want to. What are you going to be talking about too? I don't want to overlap too much.
Yeah, it's all good. Well, I'm just thinking about the muscles, and I just if you were to do the deep dive into the signaling process from having a thought or having even an autonomic nervous system response to move and do something and move your muscles, it is just insane how many little things and
Hmm.
synapses and proteins and ATP, like there's just and mitochondria, like it's all involved in just one simple muscle movement. Just me doing this right now is like thousands of chain reactions and
Yep.
hundreds of thousands of chain reactions. And that just blows my mind. Like, why? Why is our system so complex? Why does it take that much work to
It
move a muscle and yet it feels like nothing, you know?
it
So,
truly is
but
amazing. Yeah, as
it
clumsy as I
truly is.
am,
And
what it takes to keep
it
me
can
upright.
get disrupted.
Yeah.
Yeah.
Yep.
And it's not so easy for some people, right?
No,
Like you end up
definitely not.
I
Yep.
can't do
Especially.
it. My brain body connection is busted. So that is very real for a lot of folks, and
Yes.
that's what we're here to talk about.
Yep.
And then of course there is the bone health and the immune system connection. So this is a big one. Bone marrow, specifically in the femur, the pelvis, and the sternum, are responsible for producing red blood cells, white blood cells, and platelets. So red blood cells, obviously, big time for both bringing in oxygen and taking out. I think that's right. I mean, that's specifically hemoglobin. So I'm not actually sure if I'm correct on that. But the immune cells production in the bone marrow is really what's important here. Is how important it is for our bones to be functioning properly, for them to be healthy, for us to be giving them the nutrients that they need in order for them to continue doing what they do best, which is producing immune cells and producing red blood cells so that our immune system is strong and that we have healthy blood. So that's really kind of the big moment
Yes.
here of like, wow, there's just so much interconnectedness between our musculoskeletal system and the health of and function of so many other systems in the body. So we'll talk more about how to kind of keep the bones supported in the upcoming protocols as well. Okay.
Absolutely. Yep. And some of that'll come down to nutrient absorption that we're going to be talking about too, because your like Colleen was saying, your bones play a role in not only your immune system, but they are reservoirs for various minerals. And we're not talking just calcium either. The bones regulate calcium, yes, but and also phosphorus levels in the blood. That's essential for cellular functions and enzymatic reactions related to detoxification in various organs, like your liver. We know is very important with handling toxicity.
Mm,
And, also too, we mentioned a little earlier, your skeletal system, we mentioned about 7 to 10 years, it's going through that regenerative process. It's
amazing.
constantly going under that process called bone remodeling. Again, something else we don't have to think about. It just does it, where that bone tissue is broken down and rebuilt. And in addition to calcium and phosphorus regulation, it stores those alkaline minerals, also like magnesium, and that can be mobilized to help maintain the body's pH balance. So these nutrients got to come from somewhere for the bones to store them, and that's where absorption is
Yeah,
going to come in later when we're talking about it with protocols and all of that too. So tying it all
big
in,
time.
detoxification, how is your body handling these wastes? What are you bringing in? Is it getting it? And yeah, your body's
Is it
storing it
getting it?
everywhere. When Dr. Moore says dig deeper, there's a reason for that.
Love that. It's all the way in there, as deep as it'll go.
Yep.
Nice.
And I have a fly buzzing
Okay.
around, so hopefully I don't
Oh, goody.
swat my
That's
hand too
always fun.
much.
All right. Well, so that is the conclusion of our A&P section. Hopefully that you're understanding all this interconnectedness. I think we made that pretty clear. And now we're going to talk about specific protocols using Dr. Morse's formulas in order
Yes.
to support this system. So we're just going to dive right in.
Yep, absolutely. And yeah, I think people probably, if your first time here, this will be new to you. But if you've been watching the webinars since the beginning, we always talk about general maintenance at first, really focusing
Yeah.
on the body system we're talking about at the time. But you'll see probably some consistencies, as far as that general maintenance, that idea, these principles that are the foundation of everything moving forward for the protocols you're going to see, in this webinar and in others, and keeping your muscles and bones healthy naturally, you have that in combination of proper nutrition, regular physical activity. And I'm not saying you got to go high intensity or go train a marathon or anything, but
Mm.
some type of activity to keep you moving, to keep lymph and blood flowing, lifestyle habits, and some herbal supplements. So you can see some strategies on the screen, making sure you stay hydrated, not just with water, but you need those alkaline foods too. You want to stay active and moving regularly. Colleen's talked about elevating your legs, keeping the lymph flow going too, practicing deep breathing exercises, and good posture. They kind of go together. Again, that
I'm
stability
taking
for
a deep
your,
breath right now. Thanks
yep.
for the reminder.
Manage the stress, of course. Yes. You keep it under control. And healthy circadian rhythm, all of this ties in together. So, and how
Absolutely.
do we do that? Well, we've got our normal daily formulas, the GI, kidney, lymph, endocrine, your supporting key body systems at this point. And then we tie it out for this particular emphasis with the bone and connective tissue support and the muscles by nature, because they do, they support, healthy bones. Also blood flow, which is important, some lymph flow, the cartilage and connective tissue, and that muscles by nature. Anybody could take that, but really good before and after workout to just help, repair and recover after some activity and flush out those kidneys too.
Yeah, it's a great building formula. It's got the ginseng in it, which is just so good for depletion as well. So even if whether you're trying to kind of, I mean, this protocol is preventative, right? This is for all you folks that we know and love who are like, I'm on a good kick, I'm healthy, I want to stay that way. And I'm going
Yep.
into winter and there's seasonal shifts coming. We're going to be talking about that a lot next month too with our podcast. So stay tuned for that. And just how do I keep my system flowing? How do I keep my detox organs processing properly? How do I just keep things on track? That's what this is all about. And
Yep.
so, speaking of that, there's just a lot of options for folks out there on how to maintain, open up gently the detox channels, and also get a little bit more aggressive with your detox protocol, especially if you're more skilled. So I'll let Jenn take it away because she's our detox master.
Yeah, I mean, if you're not a newbie and you've worked with all of the kits before, you've done either a personalized program from another counselor or with an alumni, or you've done something yourself. Maybe you've been fasting, maybe you've been 100% raw. You might feel that you want to revisit the cleanse at a point like this before winter really hits and whatnot. So you could, instead of starting in the early stages of the Ultimate Detox kits, you could probably start in week 9, because these formulas from that point forward, you see those stronger lymph movers, and you see a lot more tissue targeting formulas like the pancreas support in some of these kits. So if you're very experienced, and remember, you're not rushing this. This is not a sprint. This is, something you're always, working to support your body and clean out toxicity. Just by starting at week 9 doesn't mean you've cut the cleanse in half. No, absolutely not. You need to stick with it, but you can, if you're looking for a deeper detox experience, start with week 9. And I recommend that if you're a little more familiar with the herbs and the diet, for sure.
Yeah, I didn't tee that up for you very well, did I, Jenn? I'm supposed to first talk about the other kits and for newbies. So if you're new here, let's backtrack for a second. If you're new here and you're like, where do I start? We have a couple kits for you that are just going to be really gentle and great trial kits for anyone who's interested in detox but might not be ready to go all in with the Ultimate Detox kit, which is 9 formulas. So that's a lot to take 3
Mm-hmm.
times a day. So there's the daily detox kit, which is the capsule forms of our 4 daily pillar systems. We do the gut with GI daily. We do our endocrine system with endocrine daily. We've got the lymph drainage daily for the lymphs and immune system. And then we've got kidneys and bladder daily. So that's the foundational 4 systems that Dr. Morse always supports in pretty much every protocol.
Yep.
And these are the dailies, so they're the most gentle of all of our formulas. Then if you want to get a little bit more specific and a little bit more aggressive, you can get the Fab 4 kit, which includes a little bit stronger of a lymphatic mover, and you can choose your GI daily formula. So if you need a little bit of movement in the gut, like you're not having 2 to 3 bowel movements a day that are like a Bristol stool chart 4, isn't that right, Jenn? The 4
Mm-hmm.
is what we're going for. Yeah, so if you're not there yet, you can use one of the movers to help things kind of move along a little bit and then come back to the daily once your diet's regulating your bowels, or you can go with the GI loose if you need to kind of solidify
You're
things a little bit more
yeah,
and
on the opposite end.
hold on the opposite end. Exactly. So you can choose your GI
No
mover
pun
there. So
intended.
that's kind of the newbies. the newbie kits, and then there's always Ultimate Detox. So this is kind of,
Yes.
we're talking fall, we're talking winter preparedness. This is the season, just like spring, for a detox. It's what we always tell folks, like this is the time of year. Go for it. Try out one of our kits. Just do the raw fruit diet, and then you'll just kind of be really, your body will be able to really move into winter as clean and healthy as you want it to be.
Yep.
Okay, and now we're going to do my favorite part, which is talk about some herbs. So we're talking about the general maintenance protocol, right? And so what are
Hmm.
some more generalized herbs that we love for supporting this musculoskeletal system? And dandelion is just one of those that is such an incredible herb. Every part of this plant is edible and usable and health and wonderful for supporting different systems. The leaves are bitter, so they're really good at stimulating digestion. They're also diuretic, so they're really good at supporting the urinary tract. High potassium content in dandelion leaf specifically, and that's wonderful for kidney regulation and balance as well. And then we're specifically talking here about bone health, right? So not just dandelion, but a awesome synergy between dandelion and burdock root shows a synergistic effect when taken in combination for I didn't take that word out again. Curing. No, we are not allowed to say that. For supporting the absorption of iron more proficiently from the diet, from your foods, essentially. And so iron, this is a big one. It's essential for the proper functioning of the skeletal muscle tissue, right? So we need our iron, and dandelion root is wonderful for that. And also iron deficiency and iron overload. Too much of the wrong types of iron can both be weakening to the bones. So just keep that in mind. Dandelion tea is delicious as well. Bone and connective tissue tonics, or sorry, bone and connective tissue support is our primary formula that has that dandelion root in it, and it's in our general maintenance protocol. So that's why we love this herb.
Yes.
And I wanted to show this particular image because there's a lot of lookalikes out there in the Dandelion Asteraceae family, and you want to get these proper dandelions that have the jagged teeth and have everything growing from a single point, and every single dandelion flower has its own individual stalk. So if you're finding a yellow Asteraceae flower where there's branching flowers coming off of one stem, that is not a true dandelion. And once you pick the dandelion, you want it to bleed like a white latex, and that means, again, that it is a true dandelion. So don't go using those fake ones because they don't have the same therapeutic effect.
Good to know. I see the lookalikes
Yeah,
growing everywhere.
everywhere. They're everywhere. It's the
Yep.
Asteraceae. That family of plants is mega, and there's so many dandelion lookalikes out there. It's crazy.
Indeed.
So another great mineral-rich herb that is in a lot of Dr. Morse's formulas and that we love for supporting the musculoskeletal system is alfalfa. It's also great for a lot of livestock eats this too. It's all just
Hmm.
because it's high in minerals, and it's valuable for supporting bone density and promoting overall musculoskeletal function. It's been used traditionally to support joint flexibility and reduce discomfort. It's largely due to its ability help the body maintain healthy inflammatory levels. And it also has some saponins and flavonoids, so that's that antioxidant content. And so, when the bones are depleted, they are oxidizing. We're talking about mitochondria that live inside the muscles and the bones and help that tissue stay healthy and help those responses, those kind of neurological responses. So antioxidants are great for helping to support the health of the mitochondria. Okay, so also really fun side note is that our alfalfa in our formulas is actually alfalfa leaf juice. It's not just an extract of alfalfa dried. So we get a freeze-dried alfalfa powder that we rehydrate as a juice and put in our formula. So it's super
It's very
yummy.
cool.
Actually, it's quite delicious. So those formulas are really yummy to take as well. Okay, so there we
Yes.
go with general maintenance. Now we're going to move on to our next
Yeah,
protocol.
and this is a big topic for anyone when it comes to the musculoskeletal system is the discomfort in muscles and joints. And you'll see the first thing, what leads to that joint and muscle discomfort? Well, we have acidosis mentioned. And well, what do we mean by acidosis? We're always saying it. You'll hear it in videos a lot. So And really, it's an abundance of acid accumulation in the tissues, in the body. And this stimulates production of, we've talked about that healthy inflammatory response. Keep that in mind for a later slide. That recruits white blood cells like neutrophils to injured tissue. And again, those help us maintain a healthy inflammatory level. They have that role in that. It helps the body. These are present when you're healing from an injury. They're also recruiting other cells to come in for that immune response. And also for discomfort, you have these acid-sensitive sensory neurons that are located through the tissues, including your muscles, joints, bones, everywhere, and that's part of the reason why we also experience comfort, how we can actually feel it. And, even our cells have their functions, their byproducts, their wastes that hinder that cellular function and that protein synthesis. Not even going to try that again. When wastes are not eliminated. Okay. So.
Tongue twister.
How's
that tongue muscle going for you today?
Yep. Oh, it's just not working. That connection. Nope. Not happening.
Not there today. It's okay.
Brain muscles to flex.
Think you fall.
Yep.
Just blame it on the day.
Oh yeah. So yeah, sluggish lymph flow and reduced blood flow. I mean, that probably could be part of my problem because I was yawning so much before this. You have your wear and tear, over-exercising and overstretching. And yes, that really is a thing. You don't want to overstretch. I know you can ache and whatnot, but there is a point where you're just, hyper-extending or doing too much. But yeah, you don't want to, remember, too much of anything in any direction is not a good thing. And of course, tension can increase with what we're exposed to, or lack of movement, lack of, the good blood and lymph flow that we need, and then also nutritional deficiencies. If you're not getting enough, like certain vitamins and minerals, as vitamin D, magnesium, or potassium, you know how you can cramp up or feel sore when those are lacking, so we hear a lot about electrolytes. You got to replenish them. But when it comes to tying all this together, your lymph, your blood, your musculoskeletal system, when you're looking at kind of targeting some more discomfort, probably more on I would say chronically, not an acute injury or anything. That's what this protocol keeps in mind. You have the kidney and bladder hydrate to really help with the hydration of the kidneys, help with waste elimination, regulate those electrolyte levels. That's important to keep that acidosis at bay. The lymph gentle mover, unless you're really experienced, your kidneys are filtering and you want to jump it up a bit, but that can alleviate that acid accumulation in your tissues and joints, and you get more support with the healthy joints for that. Spasm calm for soothing and relaxing effects, and of course adrenal support for not just healthy hormone levels, but that healthy inflammatory response, blood flow and nerve support, and you can even apply the ultimate salve, to those areas where they're just red, irritated, maybe even a little swollen. Just work on and just encourage that massage and that blood flow to those regions too. That's important. Really stimulate that recovery.
Yeah, topical massage is great.
Yep.
If you can do it.
Yep.
Oh, I should have said trigger warning.
Yep.
Jen said
scary
she jumped
herb
when she saw the slide because she's afraid of spiders.
Yes, it just looks like a spider. I'm sorry.
And I know there's
really
a lot
does.
of people with arachnophobia, so sorry, y'all.
Yep.
It's a cool seed pod, though, isn't it? This is Devil's Claw,
it is.
and that's where it gets its name. Look at that devilish seed. Oh my gosh, pretty cool.
Yeah, it is cool.
It's either that or that's the tuberous root. I think that the roots also have they're tuberous and thick, and they have kind of a branching.
That thing just commands respect.
Color,
everything.
Yeah.
Yeah.
Well, and it grows in some pretty tough spots. It grows in Southern Africa. It likes those sandy soils with lots and lots of sunlight. So you can just kind of see, and that's another potential reason for the name. It's just loves it hot and dry, and obviously those get stuck in the hairs of animals and travel pretty easily. So we've got a couple of claws that we're going to talk about: devil's claw, cat's claw. They're all great at what we've been talking about here, supporting that healthy inflammatory response. And that's about as in-depth as we could say on that, but it has some great supportive therapeutics, the phytochemicals in there that are helping to reduce joint discomfort and improve mobility, especially in cases of joint stiffness and soreness. So this one's found in healthy joints, which is one that it's just kind of in the name. It's perfect. It's made for this system. And we're going to talk about a few more great herbs that we love that are in our healthy joint formula as well.
Yes.
So Willow. Willow is in spasm calm, and Willow is such a really special herb, right? It's a tree. We use the inner bark. It's a we know it loves water. It thrives in moist spots with along riverbanks, and it has salicin in it. And salicin is pretty incredible stuff. So white willow's main claim to fame is that it was particularly significant as it was associated with the discovery of aspirin. So the primary active compound is that salicin. It's a natural chemical that, when ingested, converts into salicylic acid in the body. Salicin is widely recognized for its ability to support healthy inflammatory levels, making white willow an effective herb for easing joint and muscle discomfort. It also has those flavonoids. Flavonoids are those antioxidant-rich constituents as well as tannins. So you can see how that would support kind of the integrity as well as the tone of the muscular system. And so Spasm Calm is specifically for smooth muscle and muscle discomforts. And so willow is really well employed in this formula. Absolutely. And another great herb that is in our Spasm Calm formula is Cramp Bark. And Cramp Bark is just, I mean, I feel like anyone, like in my early days of learning about herbs, Cramp Bark was one, especially as a woman and a person with a uterus. It's just one of those ones that's recommended very, very commonly for premenstrual and menstrual discomforts and any imbalances associated with that system. So the uterus, again, is one of those smooth muscles. It's one of those visceral hollow organs that are so well supported by these antispasmodic herbs. So cramp bark is antispasmodic. It's kind of its main deal. It's also got those flavonoids. Again, they keep coming up. So those are also wonderful for supporting the antioxidant piece that I keep tying into how those signals are sent and how important those mitochondria are. And so we got to keep those mitochondria healthy with our antioxidant herbs.
Yes.
Okay, so really great text in this slide. Cramp bark has been a go-to herb for those experiencing muscular tension, particularly in the back, neck, and pelvic areas, also known for supporting healthy inflammatory levels, adding to its value for discomfort in the
Yes.
joints and joint mobility. So it's also in GI loose, which makes sense, right? Because we're talking about how these antispasmodic herbs are supportive to all smooth muscle. And where else did we talk about there being a bunch of smooth muscle is in the GI tract, specifically the intestines, which is where we can experience some cramping and some discomfort. So that's, again, another reason Spasm Calm was created. It's a really cool formula. Okay, so
Yes,
that's healthy joint and spasm calm herbs. And now we'll go even deeper into muscle and bone integrity.
Yep, and that ties in with the, previous protocol too. You get that discomfort, that stiffness, and you get over that hump. You've cleansed a bit, and now you need to, really build up that integrity, maintain it, and it requires to do so to maintain the health of the bones, the tissues. You have a bunch of, combinations you can do. Of course, a healthy alkaline diet with plenty of nutrients to nourish the body. Need to support your elimination pathways, hormone balance, support the nervous system, and of course, still stay active. You need to, tone the tissues, and make sure there's still some resilience there. And I wanted to just touch on, we always touch on diet a little bit in these webinars, and I wanted to hit that point on absorption.
This is a great slide.
And
yeah.
And just to talk about these food combinations and timing about how I know we talk about it in consultations, but how to optimize your digestion and also cleansing. We focus a lot on fruits and veggies. That's a big component to this chart here on chemistry, acid and alkaline ash. You've probably heard that. What foods are alkaline? What foods are acidic? We know the basics, but when you get into that ash, it refers to the residue left in the body after your foods are metabolized, all right, like absorbed too. So that can affect the body's pH balance. So when you look at the chart here, you see alkaline ash foods and you see the acidic ash foods. And that's these alkaline foods are considered beneficial for neutralizing excess acidity, helping with that muscle recovery, the bone health, the overall, pH balance of the body. And that also supports the healthy kidney function, reduces that workload on them to excrete all this excess acid. So take a look at this chart, screenshot it if you want. Keep this in mind when selecting your foods and combining them, because you need to design the depth of cleanse, especially at this time of year before you go into that introspection. What kind of cleanse do you want to experience for your personal goals? We all are different. We all have to start somewhere different. We all finish differently too. So keeping this in mind, food combinations that helps you achieve the better outcome for your health and your goals. But yeah, to get into, well, put all this together, how does this actually tie in with herbs to support, your tissue integrity, your bone integrity? And this is where we get into the herbs of course, your kidney and
Did I
bladder. Oh, no,
hold
you're
on?
okay.
Did I take your you were going to say absorption and um I didn't want to miss that piece.
Oh, okay.
So, did
Oh, yeah.
we cover that fully?
Yeah, I mean, pretty
That's a big
much.
one
I
here.
mean, we have our different nutrients and all of that are, very important for, absorption. We got to maintain that gut health, kind of what you were talking about as far as when we were talking about the kids, making sure you have normal and regular bowel movements. You don't want to be too loose. You don't want to be stopped up. It really, toning that, mucosal lining, cleaning residues. We're going to talk about that more too. But
Love
you
that.
have some supportive formulas in that area. And this is where the pancreas formula you see on the screen really comes in to
Yeah.
stimulate that better digestion and absorption. Choosing a GI daily formula is not listed on here, but choosing that GI daily formula that meets your needs, keep your diet clean, keep hydrated. Also, too, elimination and nutrition, that's a big part, I think you can see now, of the health of your tissues and your bones. Your cells need energy, and they need that right energy. We can't put too much of a burden on the rest of the body. So use the previous chart to just design, again, that helpful diet along with this protocol that will support your, the tissues, the muscles, the bone. And also, you got a bit of the immune component in here too, I think, with the bone and connective tissue support.
Yeah,
Do we not? I
with
think
your
that one has
antler.
the deer antler. Yeah.
Yeah. hmm
Yep.
Well, and the picture that you're painting here, we're talking integrity, we're talking strength, because we do see it does happen that if you're strictly on a fruit diet, it can be weakening over time. You can end up in the situation where you need to rebuild. So that's why we had that last slide here that has the legumes and the nuts, and you can also add some organic oils, cold pressed. These, especially going into winter, where if you are from a colder climate and you need to kind of build a little bit more insulation inside your body. And it's hard to find fresh fruits. It's okay to include those things in your diet because we want to ensure that you have bone strength and muscle strength, and
Yes.
food is fuel for that. So what Jen's speaking to about absorption and opening up that digestive pathway so that more nutrients end up in the blood and end up getting taken to the bones and muscles, as well as the endocrine system. I know a lot of folks that come to us with thyroid imbalances. We
Mm-hmm.
often say, let's check on your absorption first and see how well you're actually absorbing nutrients from your food before we start targeting the thyroid specifically, because it could just be a nutrient deficiency issue. So that's all stuff to consider with kind of
Mm-hmm.
strengthening any weakness in this area.
Yep. And an
And
awareness of
yes,
your body. I mean, that I think
yeah,
is, really helping you get in tune, with yourself, not just taking advice
yes,
and, applying it. It's like you got to learn
beautiful.
too. Yep.
It is. It is. You have to really strike that balance with your own intuition and building
Mm-hmm.
that up. And this is the time of year for that. We're going into that introspective
Yes.
season where you can really listen to what your body is telling you, and don't get too caught up in any one guideline from any expert, from Jenn or myself.
Yep.
It's really all about your personal journey and what your body is telling you it needs.
Yes.
Okay.
Definitely.
Good
Cool.
call. Good call. Okay, so deer antler is this one of these amazing supportive not herbs. It is a substance
Yeah.
that comes from a deer's head. We source ours sustainably.
Yeah.
The deer shed these every year. I believe around this time of year, I wrote an article on this and I am already forgetting, but they shed their the deer shed their antlers annually, and we collect those, or we have folks that collect those off the forest floor for us. Those get broken down into a powder and get extracted into our formulas. And yeah, they've got a really interesting and helpful complex of nutrients and vitamins with zinc and iron and protein, vitamin B, amino acids, glutamine, lysine. It just goes on and on. So obviously, you can imagine how that would be wonderful for promoting bone and joint health. And so I really think of this when it's in Ultimate Immune and it's in bone and connective tissue support. And I really think of it for that bone immune piece where we really want, if the immune system is downregulated, if it's not functioning as it should, we go for the deer antler to really boost up
Mm-hmm.
and build up that immune response and strengthen the bone health so that the bones can give you the immune cells that you need to have your immune system function properly.
Mm-hmm.
So that's deer antler. And then we've got white oak, which Dr. Morse puts in a ton of formulas. This is the short
Mm-hmm.
list of all of the formulas that white oak is in because it does so many wonderful things. And it's also such an abundant resource. I mean, there's oaks. I'm from like Grove region. So it's one of my favorite trees. They're so beautiful and ancient. And I always see just these huge grandmother oaks growing. And I just have to pause and give thanks and send love to these stoic oaks. And I just feel like that strength and that like steadfastness of the oak is a big part of its doctrine of signatures when it comes to bone and joint support, right? It's got all
Yeah,
these
absolutely.
limbs that it's holding in all these really interesting ways. And you look up one of those trees that you really think, oh, that looks like a brain. That looks like all the interconnected neurons of a brain, you know?
It does
So
take on a different characteristics, different body systems,
yeah.
lungs, that. Oh yeah, it's just pretty amazing.
Oh yeah, it's got it all. It's so cool. And it's highly tannic. So those tannins are tightening, they're astringing, and we love that when it comes to bone and muscle and tissue integrity because if you have lax tissue, it's really going to enliven and awaken that. And it also helps kind of bring other nutrients deeper in. So it's supportive in that way where it's tonifying tissue. It's activating the tissue. It's waking it up to function more in a I'm trying to not say a bad word in
That's
a
what I kind of
supportive
figured.
way. Blah, blah. But so so like say you take it in combination with deer antler and all those great nutrients from deer antler, the oak is really helping to deepen the kind of penetration, if you will, of all those nutrients deeper into the bone and muscle through
That makes
activating that
sense.
tissue. Yeah, so that's why we love some oak and we use the bark in our formula specifically. It's in bone and connective tissue, it's in blood support, lymphatic drainage daily, blood circulation. Again, that's the short list. I should talk faster. Okay, so horsetail.
You're okay.
I always get to this point in the monographs where I'm like, oh no, we're running out of time. So another mineral rich herb, high in silica. This is horsetail. It's a prehistoric plant that, they say they found fossils of mega horsetail. There's also some really huge horsetail species that grow closer to the equator as well. But that silica content, it really helps just support the integrity of tissue again, kind of like what we were just talking about. It helps to support normal bone growth and the structure and function of the urinary tract as well. So it's
Mhm.
a big one in a lot of our kidney and bladder formulas. It's in bone and connective tissue support. And we also have, if there's still any in stock, a horsetail tincture.
Yeah, you do.
Okay,
Yeah.
maybe. I think I checked that before I put that on the slide. Okay, so now we've got one more protocol for you. Jen will start us
Yes.
off.
And you've seen this one in multiple webinars. If you're
Yeah.
brand new, this will be good for you. But maintaining healthy inflammatory levels. I mean, as far as it pertains to the musculoskeletal system, when we talked a little bit about immune response, and after injury in the bone health, it helps with tissue repair and recovery, bone resorption, information. That's where that old tissue is broken down and replaced with new tissue. That's always happening too. Protection from excessive use. Again, that repetitive overuse, stretching too much, all that, and yeah, and better blood flow, lymph flow, nutrient delivery, waste elimination, hormone balance, immune system. I mean, that's all of this ties
Yeah,
in
less
with part of
taxing
this
on the immune
healthy.
system.
Yeah, so you got to
It's a
control
big
this
one.
area, maintain the balance in the body. It's just really essential for the whole body's function, but the musculoskeletal system too. And this is where we get into kidney bladder drain to really promote that deeper, drainage and cleansing, of, the urinary tract, but also with the gentle mover lymph drainage formula. Again, if you're more experienced, you can certainly go up into the more moderate and super, but make sure your kidneys are filtering. And some of the things we touched on, you'll see these formulas highlight that, making sure your blood flow is good, your lymph flow, the healthy joints for more support, and just the body's efforts of cleansing these acids and getting it to a much healthier balance. The ultimate immune for that healthy inflammatory response and immune support. brain and nervous systems formula, for that nervous system connection to the musculoskeletal and also that circulation support. And then, surprise, look at that last line, turmeric.
Oh,
Many of you take this
exciting.
already, and we will often recommend it as an aside, in a protocol. It's in healthy joints, but sometimes you need that added boost really for maintaining and whatnot. So I know you're probably going to talk about this one, right? I didn't look ahead
Yeah,
after this. I'm sorry.
actually, I don't have like a picture of the new product, but we do have a new product drop. It's so
Hmm.
exciting. We have a turmeric curcumin capsule, and I know that it's going to be included in the discount code, but I think we have some in stock on the site, so we'll see how that goes. Anyway, before I dive into turmeric, which it's my next slide, I just wanted to continue on with this protocol page because everything Jenn said is amazing. And what she was saying about kind of increasing your lymph drainage mover, oftentimes in our protocols, we'll add 2 kidney bladder formulas to this when we start to really move the lymph a little bit more aggressively because we really want to ensure that those kidney pathways are open. So we'll include a drain as well as a daily, let's say. And so you can consider doing that. And then what else was I going to say? Blood circulation. That's a big one here. It's very warming formula. It's got one of our warming herbs. I believe it's cayenne or prickly ash, one of the two. And that
Yeah.
heat from those warming herbs is really helping kind of increase heart rate and move blood. And so that's a big one for when we're trying to support the inflammatory response. Um, yeah, so that's a couple things I was going to say on that. And brain and nervous system is on here specifically for post-surgery support, right? Because there is also Goto colon, brain and
Hmm.
nervous. We'll talk about it in a moment, but it's specifically wonderful at the connective tissue rebuilding, supporting the rebuilding of connective tissue. Okay, so
Yes.
let's talk turmeric. Um, a wonderful I think the reason we really decided to dedicate an entire capsule to just turmeric is because we all know at this point, right, that turmeric has a lot of buzz around it. There's a lot of incredible studies showing how supportive it is to the inflammatory response, and as well as those curcuminoids, that's that main constituent that is in turmeric that's so supportive to that healthy inflammatory response. It also supports the activity of the immune cells, including both the T and the B cells and the macrophages and the natural killer cells. So it's kind of got some antioxidant support in that way. So we've got both our so it's really that immune conversation around how the inflammatory response is regulated oftentimes by the immune system. So turmeric's not only helping to modulate that response, but it's also strengthening the immune system in general. And that orange color we all know is
Yes.
carotenoids, which are also highly antioxidant as well.
Yep.
So yes, we will have a link to the turmeric curcumin, which you can also buy on Amazon. It's a capsule that's a high dose curcumin, which is really cool. Okay, cat's claw is another. Remember I said we were going to talk about the claws. So like devil's claw, it's another
Yeah.
one that's great for
You can
supporting
see
the
it.
inflammatory response. It's got that claw-like stem. And we use the bark here, the inner bark. Let's see what do I want to say about this. I'm sure the slide itself has got everything we need to say. We've got some cool POAs that help to promote healthy immune response by stimulating the production of white blood cells. Great, so supportive in that way. And we've also got some quinovic acid glycosides, which are known for supporting that inflammatory response, helping the body to manage the inflammatory process, contributing to joint comfort and promoting musculoskeletal health. So that is in healthy joints, as well as our ultimate herbal blend. And one more here. So I mentioned earlier, just a second ago, that brain and nervous is included in this protocol specifically for post-surgery, or if you have some sort of wound that you need to support the healing process on. Gotu kola is a beautiful tropical vine that is delicious. If you can find the juice, if you happen to be traveling in some Asian countries, you can find that there. But it is known as a connective tissue tonic. It supports the tissue in the muscles and is used both internally and externally to support tissue function, flexibility, and integrity, and the healing of wounds. As studies do show that it promotes collagen synthesis and modulates scar tissue. So it's a really cool plant, both topically and internally, for that.
Very pretty.
Yeah, and it's pretty. Okay, so that's it for our herbs. Oh my gosh, we still have time for therapeutics. This is a
I know this is like a wonderful first
groundbreaking
or
moment.
second.
How did we do
We did it
that?
with respiratory.
All right, go us. Okay. Maybe it's because we talk like insanely fast. So hopefully your heads aren't
Yeah.
spinning.
And
Um,
if they are, sorry.
Sorry, a few more slides here before we get to our
Yes.
cool discount code, but we wanted to mention some great recipes. I love this turmeric paste recipe. It's a go-to I've done for years where you kind of keep this paste stored in the fridge and then you can add it to warmed up water in tea form, or you can add it to a coconut milk or a, homemade oat milk. Um, and so it's just a combination of turmeric as well as cinnamon, some ginger, or pepper and or both. Pepper activates and helps to really drive home that supportive inflammatory piece of turmeric. Some coconut oil here to kind of thicken it up, and you just reduce this. You reduce this on the stove because you start with 1 cup of water and you cook it down until you have a paste. And I mentioned here, I think it's great to add other adaptogen powders to this paste. So I just gave you a few ideas here: ashwagandha, shatavari, eleuthero, dong quai, to name a few that can be added to this turmeric paste to allow it to be even more supportive to
Very
the
cool.
system. Yeah.
Totally looks like fall for real.
I know, I'm ready for it, right? Set the good recipe for fall.
Yes. All right. And this one, I won't go like too crazy because I have a lot on the slide. But we
Hmm.
get, questions about hot and cold applications, when to use it, when to not. So take a quick screenshot of this. And, they both offer therapeutic benefits for the musculoskeletal system to really, target that pain post-injury, stiffness, muscle spasms. So just really note the similarities between the two, avoiding during use. And we need to keep in mind that we still have to work on internally to improve our blood and lymph flow, to really enhance that tissue integrity and experience the full and the safe benefits of, heat and ice therapies. So heat therapy obviously involves applying warmth to an affected area, whether it's a heating pad safely, warm bath, or warm
So
compresses.
nice.
Heat's more effective for, that chronic pain or chronic discomfort, probably a better word to say, that stiffness and that muscle tension. My bad.
I know I immediately was
So,
like,
yeah, it's like trigger. So, okay. So avoid avoid it, when you have those obvious signs of swelling, redness, you got open wounds. If you have nerve damage, that'll go with both of them because you're not going to tell if it's too hot or too cold. You got to be careful. So 15, 20-minute applications only. Take a break. Don't fall asleep with a heating pad on, especially an electric one.
mm,
Please don't do that.
mm-hmm.
Physical therapy, people would tell us they did it. Like, don't. Cold
Ouch.
therapy, yeah, for sure. Cryotherapy, that includes ice packs, cold compresses, ice baths. Ice baths, that's really, I don't recommend that unless you're, athlete, someone under supervision,
Mm-hmm.
before you
Mm-hmm.
go and do something like this. So let's keep it to cold packs and compresses. Perfect for acute injuries and swelling. So it just really helps calm the area, and that also enables the body to kind of begin that healing process. And again, best in
Yeah.
15, 20-minute applications. Give it at least 30 minutes or maybe more in between. But, with acutely, you want to keep that cold compress going. And when you want to look for more maintenance and therapeutic effects, you can alternate between the two of them, just like a contrast, to really reduce the discomfort, but also, bring in that fresh blood nutrients after you've reduced that inflammation down. Oh, I said a bad word. My bad. It's actually
Y'all
used in
probably
this
don't know
case.
what we're freaking out about,
Yeah,
but it's like we have to,
that's a
there's certain
trigger
words we
word.
can't say as a supplement brand. They're trigger words for the FDA. So
Yes.
I probably
Yep.
shouldn't have even
But
said
it's
FDA.
related to
Ugh.
this. This is
Anyway, trying
recommended.
to stay under the radar. Yeah.
Yep. But yeah.
Cool. Hot and cold compresses. We're at 2 o'clock. Thanks for those of you who can stay tuned a little bit longer. Salve making 101 looks like we won't really get to this slide, especially because it involves math. But we do have it. I do talk about this in our podcast on the musculoskeletal system, which you can also watch the recording of at our YouTube channel. Um, it's called the Detox Talks. So we just started doing podcast, Jenn and I, just a couple months ago. So we're on our third one. We'll be recording one tomorrow, actually, on
Yes.
holistic health, and we're really excited about that. So definitely make sure to check your emails for all of our upcoming podcast recordings as well. Just trying to get that information out to you as much as possible. But making a salve is really easy. You just add a bunch of beeswax to oil. Here's some herbs that I recommend infusing into oil so that your oil is supporting you topically. It's not just oil, it's oil that does something. And yeah, so I can't go much more into that because we don't have time. So here is what you've all been waiting for, the code Muscle Bone 20% off all of these formulas that we discussed today. Here's the short list. No, this is the full list. No short lists here. This is all the herbal formulas we talked about today. And you will go to our website and actually, so this is another important factor. Those of you who joined us live on YouTube, I know I mentioned this at the beginning, but I think it's worth mentioning again. You may have not signed up for the follow-up email because you have to do that through our website. So if you are just listening in and tuning in because you happened upon our live feed, welcome. We're excited you're here, and we want you to enjoy this discount code as much as everyone else. You can just go to our site and grab all these products and put them in your cart and use this code and you're good to go. But we do have a follow-up email that we send, and it includes a recording of this webinar as well as the code and a link to an entire page on our site that has all of these formulas on it, which just makes it a little bit easier. So I believe Gavin put the link into the chat, but if you go to drmorses.com and you go to the Learn tab and then learn from our experts, there should be a webinar registration page. And on that page, you just put your email address and your phone number if you want to receive texts. And then we will have your email address and we can send you the follow-up email. So yes, a little bit of housekeeping there, but that's how that works. Great. So one last stretch. We did it.
Yep.
Don't forget to move that body.
Yep. Go out, rake some leaves, whatever you got to do.
Go out and rake some leaves. I love that. Yep. I should do that. Yes.
Can't do that.
Or leave the leaves. There's a lot of herbalists who are all about leaving the leaves because it's better for the dirt to let things decompose.
I mean, unless you're creating a pile to jump into them, I'd probably leave them.
Oh, my kid
says the Floridian who's never done it. So
yeah, we have lots of leaf piles, and I do leave them often because I'm too lazy to put them in my compost bin. So
it's probably what I would do too.
We love you all, Jenn. Yes. It's always a pleasure. Thank you all for your time today. Yes.
Thank you. This is always fun. Yep. And just chatting and meeting some of you after the fact too. It's pretty great. So thank you for tuning in for sure.
That's right. Jenn mostly, but me a little bit. We both do health consults, so you can always book a consult directly with us and talk about your personal health goals as well. So yes, thanks again. We will see you next month. We're taking a webinar break. We will have a podcast, so you will get an email for that. And then December, we'll be doing holistic health webinar on the 18th of December, right before the holidays. So we look forward to seeing you there. And thanks again, everyone. Have a beautiful day.
Yep. Bye, everyone.